Good afternoon. My name is George Gibore. I'm the General Secretary, Kenya Union of Clinical Officer. And together with me is the Treasurer and also the Deputy General Secretary for the Union. And sorry, we expected some of us to be here. There is another meetings that are ongoing. We had to exclude ourselves to be here, and that's why probably a few of us must be here. And as we had indicated, is about the resumption of the strike, where we had given 21 days to the employer to address our grievances. And because those grievances have not been addressed, that's why we are here today, deliberately to communicate to the public in terms of how do we move on from here. Some of the issues that we are raising are historical in nature. There are same issues we raise every year, discussed, agreed, implementation become a problem. And that is why we continue in the same manner that we have a strike, have agreement, return to work, not implemented again on another strike. And it is unavoidable, so to say. You'll allow me read the statement and then I'll be able to give an overview of all the same, because then that's what cements our communication today. Members of the press and the Kenyan large, this is our statement, that the Kenya Union of Clinical Officers wish to inform the public and all the stakeholders of the resumption of the industrial action effective midnight today, that is 17th day of February 2025, following the failure of the Council of Governors and the Minister of Health to address our concerns and fulfill the commitments made after the suspension of the 21 days strike. With the suspension notice dated 22nd January 2025. We have to communicate that indeed we received a letter from the Council of Governors dated 14th February 2025 requesting extension of the collective bargaining agreement CBA negotiation for the next 21 days, upon which we have discussed and considered that and observed that the following issues were omitted. One, on their letter that they are requesting extension, we expected at least them to communicate the next date of the meeting or the negotiation, because there are only a few things that have remained so that we conclude on the CBA. That was not included. Two is following our previous agreement, that is the Return to Work 2014, there is lack of commitment toward absorbing universal health coverage staff into permanent and pensionable terms, as agreed in our Return to Work formula dated 8th of July 2024. There is a non-dissemination of approved career progression or guideline for clinical officers to the county governments by the Council of Governors. That this is despite our request, which we did by January 31st, 2025. Another pending issue is an implementation of the resolution between the Minister of Health and the Council of Governors on the social health authority issues, which was to allow full reauthorization of the clinical officers and the facilities for empanelment, which is dated 14th January 2025. That has not happened. And therefore, there is also lack of commitment toward the promotion and the redesignation of clinical officers in accordance and strict conformity to the career progression. This is affecting most of the counties. Failure to provide comprehensive medical cover for clinical officers by some of the county. This is not most, because there are only around 14. Inadequate recruitment of clinical officers to bridge the existing service gaps necessary for realization of the universal health coverage under Taifa Care. As of course of today, additionally, we have to express our deep concern over the ongoing health summit at the Deputy President's residence, where critical discussion on the Kenya health reform agenda are taking place without proper stakeholders representation. The Kenya Union of Clinical Officers and other key healthcare representatives have been deliberately excluded, leading to the decision that risk maintaining the status quo rather than driving a meaningful reform. This exclusionary approach is evident in many ways and in the following manner. We have observed discriminatory policies affecting healthcare professionals and the patient benefit packages under the Ministry of Health, unfair favoritism in overseas treatment allocations, restricted access to emergency healthcare services through biased prioritization process, non-objective means testing tools for the patient, skewed procurement procedures lacking transparency and fairness. We firmly believe that the summit is lacking broad and exclusive stakeholders engagement, and hence cannot result in a progressive and a meaningful health policy reform. Instead, it appears structured on to entrench existing efficiencies within the healthcare system. Given the failure to address this fundamental issue, the Kenya Union of Clinical Officers regret to announce that our strike will resume in full force, affecting all public facilities, including the National Referral Hospital, effective midnight today. We urge the respective employers to take immediate action to resolve these concerns within the with the finality to prevent further disruption in healthcare services delivery. As a union, we remain open to meaningful and constructive dialogue aimed at addressing these long-standing grievances for the benefit of both our members and the public. With this notice, we notify our members as such, and also notify members of the public that they need to take care of their patients who are admitted so that they do not experience difficulties during this time. I want to clarify that we have been having a number of issues that are lapsing, or rather protracting. These are issues of the CBA, where we have been negotiating a CBA for more than 7 years without an end to it. Whenever we reach conclusion, the government always exclude themselves from the table. We have had engagement with the Ministry of Health and the Council of Governors, and it's good to mention that at least with the Ministry of Health, we have finalized the CBA. It is with the Treasury for purpose of concurrence and the SRC. We expected that that process need to be expedited because 7 years is a long time, and owing to the fact that the budgetary process is ongoing, and for any item that touches on monetary need to be included so that this process can be concluded. We have also approached, or rather addressed, many of the clauses on the CBA with the Council of Governors. Only 2 issues are still pending in terms of the allowances that have been proposed, and also the commencement date. Those are the main outstanding issues that we expect that we ought to get a date to finalize on the CBA. But having mentioned on that, it's good to notice that this January, when we were commencing our strike, we had cited 2 issues: implementation of the Return to Work 2014, and also the issues that is touching the Social Health Authority discriminative policies, where clinical officers have been excluded from pre-authorization right, where they cannot be able to offer any emergency services to patients. And also, there are facilities that are registered under the Clinical Officers Act, Council, were denied empanelment, meaning they cannot see any patient belonging to the clinical officer, where members were being forced to go through another entity without any legal framework that provide for the same. That necessitated our strike, but then the Council of Governors took leadership and called the stakeholders on the table. We agreed that these issues were to be resolved because it was observed that indeed the existing laws and policy favors clinical officer to practice in accordance to their scope of practice and their qualification. That was to be done immediately. It has not happened, and we have been following this matter. We have been informed by the digital health system team that they incorporated the data for clinical officers, all of them, and also the facility under the Clinical Officers Council. But to be allowed for them to go through, or rather to give that right, is supposed to be done by the Social Health Authority. That has not happened, hampering the service delivery and also affecting, or rather leading to this quagmire that we are in. And therefore, that necessitates the strike that is to resume today, because we find that even the last day, we saw the Principal Secretary, together with several governors led by His Excellency Mutahi Kahiga, Governor Sakaja, and they promised that this issue was fully addressed. I don't know how it feels good for any public officer to just appear in the media, to lie, so that then they purport to have done something and yet they know that they have no intention of doing so, that their interest is not for service delivery, but for personal gains. And that's why we feel that the whole issue is perpetuating corruption and entrenching corruption in policy. And we are not willing to be a complaisance to the Ministry of Health and the Social Health Authority. And therefore, we take a stance, a direction, whereby we direct our members not to offer any services to patients who are registered under the Social Health Authority, by using some people's or other people who are registered in the favored board or council. They should not use their registration number to see any patient, because at the end of the day, what you're doing, you are giving credit to a person who probably even has no capacity to do the procedure that you are doing. On the issues of pending return to work, implementation of the return to work at 2014, as I've mentioned, majority of the county have not promoted our people, and that has led to the ongoing strike at Vihiga, the ongoing strike at Baringo, and also Uasin Gishu. So those three counties, as we talk today, they have been on strike, and one of it doing more than 56 days. The others are doing 21 days, and the others are doing 33 days. That is Uasin Gishu 33 days, Baringo are doing 17 days. So as we join them on this strike, we feel that the concern of our members, the welfare of our members need to be addressed, especially on the issues of promotion, which have been delayed for several years. It has been an issue we raise every year, and it is never addressed in full. The issues of promotion, the issues of comprehensive medical cover is also a key thing, where members are not able to access services, the services that they offer. It is actually costly even to them. Today, as I stand here, I've just received an email where one of us was done a process, and the Social Health Authority did not pay comprehensively, and they are requesting us to facilitate the fund drive to complete the payment. That is not what we expect in a time when we are advocating accessibility and all this achievable, accessibility and also quality care for members, where healthcare workers who you expect to deliver the same cannot access the services. But to note is that majority of the county have not done so. They have not given any cover for our members. any cover for our members. We start with Machakos, is still pending. Makueni is still pending. Kajiado is still pending. And we have Garissa, we also have Mandera, we have Marsabit, we have Isiolo, Migori, and a number of them have not provided any medical cover for our members. And that is critical before we have any negotiation, because it is something that do not require any negotiation, is that it must be done. You know, what perplexes me is that there is annual allocation of funds that are supposed to provide this comprehensive medical cover. Unfortunately, like in Migori, they are going for almost a year now without any cover. Where does that money go? So that's to mean it is pointing out to corruption. Lastly, to mention and to, so that you are able to synchronize this, is that when we wake up today, like today, there is a summit where they have termed it that is a consultative engagement at the deputy president resident, discussing about healthcare workers without their representative, discussing issues that matters in the health sector without their representative. It is akin to status quo, because at the end of the day, who are you engaging? It is government calling itself to discuss by itself. So the issues that are affecting healthcare workers, like now currently we experience critical challenges which have resulted due to Trump communication and restraining services, or rather stopping support for critical services that we have been getting in this country. Now over 25,000 healthcare workers are not at work, creating a huge gap because we did not have enough even then when they were serving. Those have not seen those issues featuring in those discussions. And we know very well that currently some of the patients are being denied medication, including the HIV patients and TB patient, because the stock which is there must continue to be given weekly so that they look to continue working. It is critical to mention that these are issues that you need to involve the practitioners to ensure that you are able to get the good picture. And actually, we want to call the government to take take this issue urgently and address it, because many of the progress that we had made in malaria program, in HIV, in TB, is going to regress, because once there is no one to offer those services, as you talk about integrating the same services, it is critical to note that even the commodities that we use, the drugs, are not available. And therefore, we will renegade on the same issue or progress that we had made, and the infection will continue to grow. It is good to note that involvement of high stakeholders, including the president, can actually attract a decision that may actually necessitate redirecting funds for purpose of funding critical services in the health sector. But without a proper engagement, I feel that I've seen the communication is that they are still engaging in shuttle diplomacy, hoping that the US will change their position. But also, we have also the other people who have been working under Global Fund. They have worked for 9 months now without any pay. Global Fund stopped funding that program. And when they left, these people were asked to continue working. Up to date, they have never been paid. They appear to work every day. They have been pushed to mental challenges because of being pushed to work, and you are not being paid. Even January, they experienced difficulties where they cannot even support their children to go to school. We have been engaging the ministry to expedite on this issue, and the Council of Governors to no avail. And then this is why we feel that it is necessary to actually come out and make them to have some sense of addressing these issues with the emergency they deserve. The last issue is